If you feel like you have to go to the bathroom to urinate all the time, then you might have an overactive bladder. This is a condition where the urge to urinate is often way more frequent than it should be, and it often results in it interfering with your everyday life. Today, I want to show you a 4-step home physiotherapy program where stretches, relaxation techniques, and a modality known as transcutaneous electrical nerve stimulation can all help with these symptoms of overactive bladder. Normal bladder capacity is about 300 to 400 milliliters, with an average of about 8 voids per day and 1 or less in the middle of the night. During voiding, the bladder neck and the pelvic floor muscles relax, while the involuntary detrusor muscle of the bladder contracts. Urine flow should be strong, continuous, and clear, not bloody or cloudy, and voiding should be pain-free. If this occurs, please talk to your family doctor, as these are not normal symptoms associated with an overactive bladder. On that note, in terms of medications, doctors will often prescribe certain meds intended to treat an overactive bladder if they suspect there is something wrong with the internal mechanism of the bladder. And a full breakdown of the medication list is right here. And for those watching this video, and maybe you're on one of these medications and you haven't found that they're particularly helpful, then perhaps it isn't actually a problem with your smooth muscle of the bladder. If this hasn't worked, the overactive bladder symptoms are likely a result of a sensitized nervous system, and it is our goal to downtrain some of those nervous system responses to help your bladder relax. The detrusor muscle, which are the muscles lining the wall of the bladder, are under what's called involuntary control, meaning we can't go to stretch them to get them to relax like we would a contractile tissue such as your low back. This requires pharmacological intervention, so this is why the doctor would prescribe some of those medications. For treatment, we need to utilize some relaxation strategies to help downtrain some of those signals from the brain and the nervous system. The first step is to realize that that urge signal that is generated does not necessarily mean you have to go and empty your bladder. If you've had an overactive bladder for 6 months or even longer, then there's going to be a central component to those urges, meaning the signal to urinate has been chronically amplified. We need to learn how to use mindfulness to ride out this wave of urgency. Stress reduction can be helpful in these cases, and learning how to use breath work can really help downtrain that fight or flight response that we might experience from some of our life stressors. The first technique is to use breath work to achieve a state of relaxation. Box breathing is a type of breathing that I like to use for my overactive bladder clients, where we inhale for 4 seconds, hold for 4 seconds, exhale for another 4, and then hold for 4 seconds prior to restarting that box cycle. Attached in the description is a video on a 5-minute tutorial of box breathing, which I would recommend that you do once a night. The second technique to manage overactive bladder is to learn how to use pelvic floor contractions to suppress our urges. There's a video in my channel regarding pelvic floor contraction, how to do it optimally, so I won't go into it in full detail here, but I would suggest that you go check out that video. So let's say you have this sudden urge to void. I would get you to start with pelvic floor contractions for 5 seconds for 10 repetitions. Then, I would get you to use mental effort and math, counting down by 7s from the number 100 until you reach 0. The intention of this is to get your mind thinking about something else other than going to urinate, and with practice, this can absolutely be trained. As you improve, then I would get you to count down from 150, then 200, and once you're done accomplishing the task, then you can go and use the bathroom. Another tip, in social situations, try to finish your conversation or whatever it is that you're doing and not go to the bathroom the second you have that urge. A little bit of discomfort is going to be okay, and if you keep your mind busy, then you can absolutely overcome some of those overactive bladder symptoms. The third technique is to use this TENS machine to send retrograde impulses to the nerves that are responsible for urinating. You know what I'm talking about. That machine that made Dr. Ho a boatload of money? That's the TENS unit. The goal of the neuromodulation is to restore normal signaling of the nerves. In this case, we're just using it to control and dampen the signals for the nerves responsible for urination. Place one pad slightly behind and below the medial malleolus, which is the circular bump on the inside of the ankle. The second pad goes 3 finger widths above the medial malleolus. We want to set the electrical impulse settings to 200 microseconds at 20 Hz at either normal or continuous wave. Turn on the milliamps, the intensity, until you feel your toes curl or the sensation through the toes. This means the electrodes are directly on the tibial nerve. Then, turn down the intensity to the point there is no toe curl, but a strong tingling sensation. You want to do this for 20 to 30 minutes, 3 to 5 days a week, for 12 weeks. Applying the electrodes on either left or right leg is fine, and there won't be a difference if you choose one or the other. If you're trying this out at home and you haven't seen a physiotherapist, please ensure that at least you've cleared the proper contraindications. And that's the list right up here. Lastly, the fourth technique has to do with stretches that are intended to lengthen the muscles that share similar nerve pathways to the pelvic floor. By stretching and releasing the hip, the groin, the low back, and the pelvic floor, we're working on dampening the signals that are sending the messages to the pelvic floor. This of course will only work if the muscles are tight in the first place. I would encourage that you take the time and be mindful of what you're feeling during these stretches. If there are regions that feel quite tense, pay attention to this and make it a goal to relax these areas over time. You can perform these stretches either in the morning or the evening, holding for 30 seconds, doing at least a few sets per muscle group. And if you haven't tried tweaking your diet already, there are definitely certain bladder irritants that can help contribute to overactive bladder. Limiting things such as caffeine, alcohol, nicotine, or spicy foods can all help improve these symptoms. So that's it. A very quick 4-step plan on how to effectively manage your overactive bladder. If you like my content, please like the video and let me know in the comments what else you want me to cover in the future.